Judith, Pamela, and Sinead, thanks for joining me today to have a conversation about the work that we've been doing together on the Advanced Practice Review. So I've got a few questions for you, but hopefully we're going to have a nice conversation, as I say, about the review and the work that you've been doing in your own countries. So I wonder if we can kick off with you, Judith, just to tell us a bit about your role and how you've come to be involved in the NMC review of advanced practice.
Okay, hi. So I'm a consultant midwife for public health and vulnerable families. This is my substantive role within my health board. And as part of this role, I work within the 5 pillars of consultant practice. And I professionally lead a group of specialist midwives. And as part of this role as well, I was as a stakeholder for the enhanced, advanced and consultant practice framework for Wales. So I had some opportunities to look at kind of advanced practice in that respect. And it's always interested me because actually in Wales, we have a lot of specialist midwives and consultant midwives, and there's been no kind of focus on advanced midwifery practice. So when this opportunity came up to look at the regulation of advanced practice, this was something that was really interesting to me, to see how we could develop this within Wales and how I could be supporting health boards to develop this pathway for midwives.
Great, thanks, Judith. What about you, Pamela? What's your role currently, and how did you get involved?
Thank you. So my role is Head of Midwifery and Nursing, which covers midwifery, gynecology, neonatal and paediatrics, so quite a wide variation. And as part of my role, I'm involved in quite a lot of national work within Scotland and meet regularly with directors and other heads of midwifery around the country. And there has been conversations about advanced practice midwifery, not always positive, because I think there's a lot of lack of understanding because we don't have this role within Scotland. So when I was approached by, actually it was my director of midwifery who had said, would I be interested in becoming involved? And so I read a little bit more about it, and I think this is something that we could take forward. We need to understand a bit more about what advanced practice midwifery looks like. So I then obviously applied and was successful in the opportunity.
Brilliant, thanks. And I just wanted to ask, you mentioned this kind of lack of understanding originally. Do you think that your role in the review has helped to have those conversations to kind of increase people's understandings in Scotland?
Yes, definitely. The conversation has now changed, much more positive. And I think it's potentially the lack of understanding. And I will admit, when I first heard, a few years ago, well, actually more than that, because I've been doing this role now for 18 months, but probably about 2 or 3 years ago, my automatic response was advanced neonatal nurse practitioners, and now we're looking for midwives being the same, thinking of they are on the medical rota, and it's not a way that we were looking for midwives actually to be progressing. So I think that's why there was a lot of negativity at that point, was because there wasn't the appetite for midwives to become a part of the medical rota. So yes, I think definitely the conversations are now changing within Scotland much more positively, and there's been a lot of interest. There were conversations at the beginning about midwives being autonomous at the point of registration, but as this work has progressed with the NMC, the understanding and about what this is a level of practice rather than about autonomy and what is expected from a newly qualified midwife to someone who actually is at the level working at advanced practice. So definitely the work within Scotland, the viewpoint has definitely changed, the shift, and much more positive.
Thanks, Pamela. That's really interesting. And what about you, Sinead? You're our Advanced Practice Midwifery Advisor from Northern Ireland. Tell us a bit about you and how you got involved with the work.
Thank you, Paula. So yes, my career pathway, I was a direct entry midwife, and I did my training in England, and I came back to Northern Ireland as the first direct entry midwife to work in Northern Ireland. And I worked in up through the ranks. I became labour ward sister, and I worked there for 12 years. I then became lead midwife for inpatient care, head of midwifery, and assistant director for midwifery and gynae services in our trust. So my involvement was that the deputy chief nursing officer from the Department of Health contacted myself and asked me would I be interested in taking on the role within the NMC and getting involved in this piece of work. I didn't have any understanding of what an advanced practice midwife would look like. We don't have that role in Northern Ireland currently. So I was curious to see what that role would look like and what opportunities it would give midwives. Would it be another career pathway for them, a different route to take for senior midwives who have been working clinically to stay within a clinical role and not have to, traditionally we always ended up then moving into a managerial role, and that's not for everyone. So that was what sparked my interest, and just to try and understand what advanced practice midwives could offer to our service and to our local population.
Yeah, it's really interesting, and I suppose following on from what Pamela was talking about there, I wonder, Sinead, what impact you think the review has had on midwifery as a profession, and thinking about some of those conversations that you're having within your own countries, having been involved in the work that we're doing at the NMC.
So yes, I think now my understanding of what an advanced practice is much more developed, and my appetite for it and my enthusiasm for it. So when I've been meeting with like the consultant midwife group here in Northern Ireland, I've been able to explain to them what does an advanced practice midwife bring to our profession? What additional skill sets will they have? And I now understand, and the conversations within Northern Ireland is now about, okay, so what role development could we have for these individuals who it's about their level of practice. So we're looking at things like within triage services, within days obstetric units, looking at pelvic and perinatal health, and that postnatal community hubs. So there's lots of areas that we could look at developing and given opportunities, and about how that care will then look for the women that use our services and the babies and families. So it's about working with them and developing. So yes, it has really sparked an interest, and it's still in very early stages as yet, but the conversations are now happening within Northern Ireland.
Yeah, it is really interesting, and I think, certainly having you guys involved in the discussions and bringing that kind of intelligence back to the review has been incredibly helpful. And we know that nursing and midwifery are at different stages of their journey. And I think Pamela, you mentioned completely lost my train of thought now. We're gonna have to cut that bit out because I've lost my train of thought, so that's all right. But yeah, it is really interesting on different stages of the journey, aren't we? But the really valuable work that you guys have been doing in having those conversations and making sure that people are aware of the work and those opportunities, as you say, Sinead, that advanced practice can bring to the profession. Judith, I'm going to come back to you. In Wales, I suppose, just picking up on some of what Sinead has said, thinking about the impact of the review on midwifery as a profession within Wales. I wonder if you just wanted to share a bit of your insight on that.
Yeah, absolutely. So for me, this review has highlighted the differences between the nursing and midwifery advanced practitioners and the pathways that they follow. And we know it's really embedded in nursing, especially in Wales. So it's something that has been around for a very long time. We did used to have advanced midwifery practitioners in midwifery in Wales. We're going back about 20 years ago, but it did follow, like Pamela and Sinead said, that old style model of going on to fill in medical rotas, predominantly work nights, and there was differences in bandings, differences in roles and what they were doing. So they were kind of like almost just like came out of practice really, and they weren't replaced when people left their roles. But there's been through this review, what we found is that there are a few still working. So I think we've got about 5 advanced midwifery practitioners working within Wales, and again there's inconsistencies with what they're doing. So some again are still on the medical rotas, others aren't. So these inconsistencies, we didn't know this was happening until we looked at it through this review. But again, like I said earlier, the focus has been more around enhanced roles, so the specialist midwife roles and then the consultant roles as well. We've got a very active consultant midwifery Cymru group, and we've got specialist midwife forums as well. So it's trying to work out what the difference is. What is that? What would an advanced midwifery practitioner do that's different to the specialist or consultant, and where they fit? And this is what the conversations that we've had in Wales is actually where is the need? Is it and I think it's probably more around the tackling health inequalities agenda, the midwife-led care pathways, and how advanced practitioners can support that service. So there's been lots of impact from doing this review, because I don't think these conversations would have actually been had if we hadn't have been asking the questions. So it's been really good to have every health board involved in these discussions. We've presented at directors in midwifery, and Welsh Government were present there with our chief midwifery officer, and the health education institutes as well. So we've had discussions with them about what it means. And again, there were some questions and challenges around, is it similar to obstetric nursing, and what the difference between obstetric nursing and advanced midwifery practice is. So there's been lots of different discussions, and it's exciting to see what will come.
Thanks, Judith. Really interesting journeys across the different countries. Pamela, I wonder if you could maybe touch on, and we've touched on some of this already, but really thinking about the impact of additional regulation will have on the midwifery profession. So thinking, I guess, about some of the opportunities that might present through this work, and also some of the challenges, particularly within Scotland.
Yeah, thanks, Paula. So what we're actually doing in Scotland just now is we're trying to take a once for Scotland approach to advanced practice. And similar to what sounds like happening in Wales, that we're going to scope and actually see what are midwives currently doing at the moment, because there may be midwives, although we don't recognise advanced practice midwifery in Scotland as such, as an existing role, there may well be midwives working at that level of practice currently in Scotland. So there's plans to have a multi-professional review of this to scope, so we're going to involve higher education, NES. I was invited along as the NMC midwifery advisor, and also the RCM are supporting. And so we're going to have a look at what current roles there are in midwifery practice in Scotland, and how we could understand where advanced practice already exists, and how we would describe future role requirements to sit alongside our workforce plan. So thinking about having a career pathway for midwives that will include advanced practice within there, because currently that's not recognised. The principles, I think that certainly will help countries move forward with to keep the momentum going of what we've done so far within the NMC.
Thanks, Pamela. And do you think there are particular challenges of the work that we're doing, particularly within Scotland? So we've talked about some of the opportunities. Do you think there are challenges? And I suspect that having you guys enroll and having those conversations, and as you say, keeping that momentum going, has helped to keep people on the journey. We talk about people being on the journey with us, don't we? But I just wondered if there were particular challenges that you had concerns about, and you might not, Pamela, but just wanted to pick that up as well.
I think there will be challenges. I think there will be challenges, just as we've had the challenges with, as I said, just the definition. We will have challenges, and we will, again, I think it'll be about supporting midwives. So especially there may be midwives out there at the moment who feel that they're working at that level. Now, I think, again, touching on what Judith was describing about the specialists. So we have a lot of midwives work in specialist roles, and the understanding of what is advanced practice and what is a specialist midwife role. And so I think there will be challenges. I think there'll be challenges for employers, because obviously now not part of our role within the NMC, but for employers there'll be the challenges about banding, and where does this fit within organisations. So I think there will be a lot of challenges, and I'm hoping that by taking this once for Scotland approach, that we will have that consistency across Scotland. But that will be the work. There's still a great deal of work to be undertaken.
Yeah, there is still a lot of work, you're right, to be undertaken, but it is about keeping those conversations going and keeping that momentum going, and as we know, keeping people updated and wanting to engage and be involved in the journey, isn't it?
Yeah, definitely.
And Sinead, what about for you? What I know that you don't have advanced practice in midwifery in Northern Ireland, but what impact do you think additional regulation of advanced practice will have, and what opportunities and challenges do you foresee within Northern Ireland?
So thanks, Paula. I think having principles of what an advanced practice midwife will look like, having that what good looks like, will help to develop advanced practice in midwifery in the profession. I think the challenges with this is we'll have midwives who work within research posts or work within education, and it's about how do they transfer their skills? How do they demonstrate that they're working across the four pillars within advanced practice? I think that it's just about what that will look like when we start to benchmark across. So I think that's going to be a challenge. But I think the opportunities for the roles of advanced practice within midwifery will certainly outdo the challenges, if you like. It will help to improve outcomes and reduce inequalities for the care that we provide.
Yeah, thanks, Sinead. And I think both you and Judith have mentioned kind of roles and the potential for reducing inequality, which I think is really important. And I think both yourself and Pamela have touched on the principles for advanced practice, which we're taking to council at the end of March. And we've put a lot of work, a lot of stakeholder engagement that we've all been involved in, and really excited to take those to council. And you've touched on the potential impact of those principles. I wonder, Judith, if I could come to you about the potential impact that you think the principles are going to have once they're launched. Again, so Judith, I wonder if you could talk us through some of the challenges and opportunities that you see with an advanced practice in Wales.
Absolutely. So I think that there'll be some great opportunity from the regulation of advanced practice. And I think it'll enhance professional recognition of the role, and it'll give the midwifery practitioners that confidence that they are advanced, they followed an advanced practice pathway, they have they've got that as either a career in itself or leading to another pathway if they want, and it'll give them greater autonomy and care as well. So they will be able to expand their scope of practice and lead services without necessarily medical oversight. So I think that will be really important for them, for their credibility. I think it's something that is just so exciting that if we bring this into Wales. And we've mentioned about career pathways. So there are some challenges, and it's things like releasing midwives for training. So if we're going to implement this into Wales, and I think I can see Sinead and Pamela nodding here, that can be, it's trying to create that equity in training, that it doesn't affect the core staff as well, the core midwifery staff. So that might be challenges in itself, just because we've got workforce challenges in Wales. We are quite short of midwives, so trying to release them to have a proper training in order to follow this pathway. As we always say, there may be some regulatory burden as well, so that brings some administrative issues if they're looking to apply for that regulation or apply for that annotation. And so I've said this before, that the opportunities in Wales could help towards that midwifery-led care pathways, and supporting women in women's choice and leading the services for midwifery care, for that universal care. So not to have mini doctors here. It's about the maxi midwives, as Romy, our other colleague, frequently says. And look at what England are doing. England are leading the way here. I think it's important that in Wales that we do learn from their mistakes and learn from their opportunities as well, and see what we can bring into Wales. And again, they said that it's creating the advanced practice roles. It's the creation of the roles that can be the challenge. So we would need to work together in Wales to see actually where is the need, and how can it actually make the biggest impact into midwifery care for women and their families.
Yeah, it's really interesting. There's particularly within midwifery, when I talk to you guys and I hear you talk about it, the kind of opportunities are huge. And it's taking that learning kind of from nursing, but from internationally as well, and what others have done, and thinking about what that means for midwifery. And I think, we know in other countries that advanced practice in midwifery hasn't necessarily kind of been something that has progressed. But I do think, like you're talking about, there's huge opportunities, isn't there, for the profession. And of course, we're, the reason that we're doing this work is around public protection. But you mentioned kind of growing workforce and things like that. And it's actually, seeing those things as opportunities to create a better system and better services, and high quality services for women and their families, isn't it? So it is really exciting, I think. And of course, you've all, as part of the work that you've been doing, have been going out and sharing what you've been doing and talking about your roles and the advanced practice review as well, which is also really exciting. And it also means that we bring more people on the journey. We keep people more involved in the work as we progress. I wonder, Pamela, if I can come to you, and we have touched on this a little bit, as I say, thinking about taking our principles to council at the end of March, and thinking about the impact that those principles will have. And I know we've touched on already, this is the kind of foundation. These are setting out our expectations of what good looks like, or what best practice is, both for individuals and employers. But I wonder if you might expand on that a little bit, Pamela.
Yeah, so I think all being well, and council approves the work that we've done so far, with regarding the definition and the principles, it will give us this foundation, and it will give employers who are now looking at, and across the 4 countries. So although there is advanced practice within England, as we've recognised, and they are further ahead than us, you know, there's still the appetite to progress and to continue with this. So I think this work that has been done, I think the principles will allow us to sort of set out what the expectations are. Now, I appreciate at this point we're not going to have the standards, but again, it will still allow countries to be moving forward and keeping this work alive and fresh, and it's great to see the enthusiasm and the appetite now for advanced practice, and we've recognised that with our webinars that we've had hundreds of midwives have attended those webinars and been really interested. So you could see the appetite is out there, because there's a lot for nurses and midwives that they're expected to take part in now with education. So the fact that they've given up their time to actually join these webinars and being involved shows that there is that level of interest. So I do think that the principles that will all being well, I think will be made. Am I right in thinking that if the council approve, will allow countries to start progressing with this work. And I suppose I just wanted to say, Sinead and I went down to Liverpool and visited, and that was really interesting and gave us that insight of how actually to see this in practice. And for us who, you know, we don't have recognised midwives in these roles, it was really interesting for us, and to speak with them and hear their passion and enthusiasm. So yeah, I do think, I'm not sure if that's probably fully answered your question, but I suppose what I'm trying to say is that this is the foundation of where we're needing to be progressing. There's a lot more work to be done, but that what we've done so far will allow countries to take what we've got so far and be progressing with looking at advanced practice.
Yeah, that's great, Pamela. Thank you. And you mentioned when you went to Liverpool and you met advanced practice midwives and really got to understand some of the roles that they were doing. And I think you touched on this at the very beginning, Sinead, but I wonder, Sinead, if you could just pick up a little bit more about those kind of role opportunities and areas that you could see advanced practice midwives working in.
Yes, as Pamela says, that was a real light bulb moment for me, going to Liverpool and actually chatting with the advanced practice midwives. And one of them actually set out a day in the life of an advanced practice midwife, and the variation in the work that she was doing was incredible. So the areas that I think will be particularly useful for these advanced practice midwives is sort of in that triage work, the day assessment. I mean, the midwives that we, the presentation, she talked about the women coming in with premature rupture of membranes or a urine infection, her being able to do the whole assessment from the whole holistic level of care for that woman, prescribing her antibiotics, prescribing medication, dealing with the woman in a much more timely and the continuity of the care was incredible, and it really demonstrated, and the feedback from the women was so positive, that they weren't waiting on another practitioner coming to prescribe for them, or they weren't having to wait for someone else to assess them, that the fact that they got their scanning done, the well-being of their baby looked at, and themselves, and able to go home in a much more timely way. So that meant maternal medicine and the perinatal mental health roles that they could undertake. Working in community hubs is another one, the postnatal services that they could provide, and the pelvic health service roles that we all know is needed and within maternity services. So I think there's real opportunity here to develop our services and make them tailored fit for the population that we are serving, and dealing with the complex nature of women now and their pregnancies. I mean, we all recognize that pregnancies and the complexities of pregnancies is where we want to be. We want to be able to provide that midwifery-led care to all our population.
Yeah, I think that's really great, Sinead. You covered a lot in that response, but thinking about the complexities and the opportunities within complexities, and thinking about population health, and all of our populations are different, right? So actually, yeah, those things are really key. So thank you. I wonder, is there anything else that I haven't asked that you feel you wanted to cover whilst we're having this conversation?
Yeah, I if you don't mind, if I can chip in, it's
Of course.
So I think we've come on such a journey with midwifery, and when we found this out kind of more so when we were going out doing the engagement sessions within our countries and then as a group together. And we have, I think we've engaged with over like 3,000 stakeholders in total, haven't we, with this project? But in midwifery, what we found is that we were going out for engagement sessions around the principles and definition, but actually it brought out a challenge that we needed to get the basics right first, that we were asking midwives to comment on principles and definitions without really them understanding what advanced practice was and what it means in midwifery. So that's where, and I think Pamela's already touched on this, we developed the webinars to actually answer that question first. And what we found is that the engagement then was great afterwards, because people really understood what they were commenting on. So I do feel that the principles that are going to council really have had that thought behind them of with the midwifery lens as well. So it has been a complete journey. So it's really good. So I feel that these principles will have great impact on the midwifery profession, and for advanced practice, and actually it will be an aid for the countries when they are developing these roles.
Brilliant.
Paula, if I can just come in as well, one of the things I suppose I'm reflecting, and I'm just reflecting as we're sitting here today, is, as far as I understand, this is the first time the NMC have taken this approach where they've taken advisors from each country. And I think this has been an excellent approach, and I think it's a blueprint going forward for the NMC, because it has worked so well. I think from the view of us bringing from our individual countries, but also learning from each other, learning from our colleague Romy, learning from what has worked really well in England in advanced midwifery practice, and also the things that haven't gone just as well or needs tweaked and all. And we know not to go make the same mistakes and learn from those, the lessons that have come up. So I do think the 4-country approach was a fabulous approach by the NMC.
Yeah, thanks, Sinead. And I think you're absolutely right. I think that having that 4-country approach, having you with your networks within each of your countries, having the right conversations, has had a huge impact on bringing people on that journey. And I keep going back to that. I use the analogy of people were outside the bus looking in, and now feels like they're on the bus, because we've done a huge amount of relationship building, conversations, the webinars, recognizing that there's a gap there. We're talking about something that people don't really understand. How can we fill that gap? And I think you're right about the kind of the blueprint and having that model going forward is something that we as an organisation at the NMC should think about, and kind of, you know, thinking about the kind of approach and the methodology that we've used to engage with individuals, whether it's professionals or stakeholders. That's really worked. Having a public advisory group, you know, having members from maternity voices, etc., involved in that work, making sure that we're getting it right for both professions. I'm not sure that any of us thought that we would get that definition which was right for nurses, for nursing and midwifery, and yet here we are with a great set of principles that we're all happy with, that we're ready to take to council. It's been a huge piece of work, and you know, I'm a nurse, as you know, but I've really enjoyed working with you. And hoping that we can continue the journey into the future, when we do get to develop those standards. I think it's going to be really important. So thank you all.